was the best feedback?
Looking to palliative care, calcium.
I mean, most of the people who go for alternative medicine are people looking for palliative care. Like they are terminally ill, they have terminal cancer, none of these cancer medications work, and the doctor has given them 3 months, and all they can do is go for palliative care, is take care of their symptoms the best way possible. So these were the discussions in our group. Would you like to talk about what you discussed?
I actually had a private phone call, so I wasn't able to participate. I apologize.
Okay.
We can discuss
All right.
that.
We were actually talking about starting up a technology company. I have a couple of product ideas that are not related to healthcare, and we're just strategizing on what we need to do to bootstrap these ideas. Sorry, it was not the intention of this.
That's what this is all about, actually.
Go ahead.
Your response speaks first.
Well, we looked at a number of different scenarios, looking at the sort of the use case of an at-home compliance, patients' at-home compliance with their physical therapy prescription here, and went through what mechanisms would allow people, or would either incentivize or get more engagement from the patients. We talked about sort of a mutually established plan or goal, essentially a contract, and sort of the different, what's the time span, does that contract have to be renewed? And I think that's actually something we can build into the product, some sort of mechanism like that. So I took that as a very sort of tangible action item.
Right.
Boom on there. We talked about a person's personal incentive to actually engage, and it could be a reduction of pain, recognizing the more pain somebody is in, the more likely that they actually want to engage. So, tracking the level of pain, okay, this week or this day, I did my exercises, I feel this amount of pain.
Right.
The next day, so that's a very tangible thing you can build into a product. So basically recording that. We recognize that some people derive satisfaction about being able to log their data. You think of the Runkeeper model on there, where after a period of time you actually see your graph. Okay, this is my mileage, these are the number of exercises, and I think it's that visual feedback after entering your data. Okay, here's a graph showing my pain reduction. Hey, cool, I'm making progress. Also, something you can actually build into a product. And we covered another, I think applicable to any medical health, digital health device application where, user experience and making that ability to enter data as easy as possible. Whether it's voice in some mechanisms or making sure you don't have to go through 8 levels of security, just to get into your app. So, and I think that's applicable to anything on there. And we didn't really have time, but we brought up some topics of sensor-based monitoring, whether you're using a Kinect or a Wii Fit or something like that, where you actually not only can you use that to find out whether the person is doing the exercise precisely, but it's binary. If they enter the data from the Wii Fit, they actually did the exercise.
Yeah, I actually worked on using the Wii Fit, the Wii sensor devices to monitor physiotherapy. That's exactly a couple of years ago. I worked at MIT on that.
Okay. Well, there was a group there that spun out through Rock Health, a little startup using Kinect. Wasn't there recently? Isn't that the same lab?
It was at the MIT Media Lab.
I'm not sure if it was the Media Lab or what came out, but there is an entity in existence right now that is actually doing something like that.
Yeah, exactly. You're basically gamifying physiotherapy. Yeah, I think it's a cool concept.
You gotta have that. It's got to be matched to clinical workflow.
Is
Anyway,
there
so go
something
ahead.
like that is on the treadmill that shows the heart rate of the person who is doing the exercise? Is that some sort of thing like that?
Well, in a way, yes. That's actually taking a sort of a biometric. What are you actually doing? With the Wii Fit, it's actually more the accelerometers that are in the phone, which way are you moving?
Right.
There, if an exercise has to be symmetric, are you actually are you doing it precise? So it's similar.
And what other devices actually you're talking about? The
Well,
sticks or-
we didn't really we didn't get into specifics of devices, because right now we're all about the clinical workflow. Is it easy for the therapist to configure the exercises, and is it easy for the patient to consume? Right now the problem is compliance is the same as paper. Okay, great. So how do we get, for all the clinical digital workflow that we've done, how do you take compliance above paper?
So what is the unique value proposition here if someone is already doing it?
The introduction.
No, in the
Oh,
sense that using WeFit for physiotherapy, people are already doing that. So what's your value proposition?
I'm not interested in doing that right now, actually, from a business point of view, because other people are doing it.
Right.
We're more interested in clinical workflow. So what we've done is take a digital, from efficiency point of view for the provider, and then as potential wellness product offering for the payer, for their large customers.
Interesting.
So for us, HealthBox with Blue Cross is very interesting to us.
You said health box?
Yes. So
Yeah.
we're trying to get into, that's what, we're really targeting to get into that program.
Did you finish the application?
Yes, we did.
Yeah, I did too.
Good.
When is it going to be
Good luck.
done?
What's that?
When is that HealthPlus conference?
The application deadline is already finished. Just to give you context to everybody, HealthBox is a healthcare accelerator program. So if you have an idea but you don't have enough funding to make that idea happen, you could apply to that program and they give you $50,000 for 6% equity in the company.
What are their requirements for them to get the $50,000?
The requirements are
They have to believe in it, right?
What?
They have to
What
really
is the
believe
rec-
you're gonna make it.
No.
that's why they don't want to just fund ideas. They want people who are a
Implementation.
little far further ahead,
You
at
sort
least
of
a
have to have
prototype.
a minimal viable product,
Right. Yeah.
either ready to do a pilot or have done at least an initial pilot, and have some sort of, minimum corporate structure.
Right. Have a team
Yep.
put in place.
Team in place, yeah.
William, would you like to talk about your idea?
My idea was taking health records and making them able to enter onto an app, and making it easier to transfer them from one healthcare center to another, and easy for medical professionals to access without having to have the right kind of hardware or software. It would have to be HIPAA secure. I'd need to think a little bit more about all of that. It was just an idea I got sitting here.
Thank you. John?
Yeah, I was with that group, so, basically we were talking about the psychology of compliance.
Okay.
How do you get a patient to comply with, and one of the things that we brought up was just the word comply turns a bunch of people off. So, because it's something that's being imposed on them from outside.
Yeah, that's exactly
And,
Call it the fun application.
So, essentially we were where Jeff was talking about, and then the fact that you have to break it down into something where the patient has a tangible sense of what is happening. So pain is something that a patient senses. So their ability to follow instructions goes up. But if it is something like, oh, you need to take your meds for your blood pressure, which, who knows what it is. So under those circumstances, how do you, the incentivization structure differs. And obviously with obesity and diabetes and all of these hidden diseases, we get into a completely different framework there. But one of the thoughts there is physiotherapy, there is a limitation in most healthcare plans about how many times you can go back to the physiotherapist.
Right.
One potential incentive could be if you follow the instructions and do the exercises and log it at home, we will give you more therapy sessions without any fee. Right? So that incentivizes the patient. That actually incentivizes paradoxically the care provider, the physiotherapist, because he's like, I can now bill for another 4 sessions, right?
Well, plus, who wants to work with somebody who's not doing their homework? I mean,
That's true.
Do you have any idea for the diabetic patients as well? Because my mother, she just skips her medicines.
I'm diabetic too, so that's one of the issues that that is a major issue. It's not just the
They're not willing
medication.
to exercise, they don't want to have something restricted in their diets.
Yep. Tell me about it. because I'm working with a client who has a device that will help with type 2 diabetes, and they wanted to take it into South Asia, and this is my market research. What you're talking about is the market research that has done.
Alright, and another issue is that the syringe that causes the pain. In the UAE, they have the tablets of insulin. Is that available here?
Insulin cannot be taken orally.
No, there is some sort of thing that is quite relevant like that insulin, and
yeah.
it gives the same effect like insulin.
It
The patients are
depends.
more compliant with the tablets as compared to the syringes.
Effectiveness changes. So we can talk about it. That's my work. That's 15 years and 10 years at Medtronic. That's all it is. So I can talk to you about.
The other thing that was kind of interesting, I thought about the area that we were looking at was I felt like it was an unserved area, because some of the other ideas are stuff that like every hospital is trying to do. So trying to get into that market, thinking of it from a business point of view. But one of the things about the products that we were talking about is that they would primarily, I think, be used, outside of hospitals and clinics, like at home. And there aren't so many devices or applications or whatever that are out there or well known in that market now. So, business-wise, it seems to have a lot of sense to it.
I think one of the greatest strengths of your proposal is that insurance companies do have a standardized limit on the number of physical therapy visits they have associated with a diagnosis.
Yeah.
And they don't, one size doesn't fit all. A lot of patients who are trying hard to get better need longer time. And I think if you had an incentive where the patient was able to demonstrate their participation, but still needed more help, and the insurance companies were willing to reward that, I think that has a great value.
That's excellent.
Yeah, thanks. Yeah. And I think added to that, if the application makes that additional healthcare delivery scalable, in that sense, meaning it doesn't necessarily require as much time in the office from the therapist. Okay, your care plan's still available on the web, you can still look at, you can still log. That's not really consuming a lot of non-scalable provider time.
I was thinking just even simpler, just even lower hanging fruit than that. If you simply share with a patient that they're allowed 16 visits, status post their total knee replacement, okay, but if they actually go home and in between those 16 visits, not only do their therapies, but do them on a schedule that's demonstratable, then the insurance, but they need more because they just need more.
So just make a contract, we'll say contract up front, saying, hey, do this, comply, you're getting 2 for 1.
Or, right, and if the insurance company's willing to say.
Once he's doing it all at home, he'll not be in need of further visits to the physician, maybe, if he's doing compliantly the things at home.
Sure. So then you're also sifting out the patients who do need more help, right? And you don't know when you're going in whether you are the person who's going to need the extra 5 visits.
Right.
Danny, do you have anything?
It's all been said. Said well, thank you.
Diane, do you have
Yeah, so we talked about incentivizing behavior to be more efficient about delivery of healthcare, consumption of healthcare, and specifically within the context of the accountable care organization. We didn't get to any real actionable results. I would say, I mean, we talked a lot, it's extremely complicated and fairly large problem. We kind of got hung up on the issue of compensation and this whole changing model of compensation where it's not service, fee for service, but something else yet to be defined. And basically, we had an interesting conversation, but didn't get too far with it.
So the biggest problem here is how do you change patient behavior? That's all. That's all we're trying to figure it out. Yeah, education can play a big role in that.
Incentives is
Well,
a
that's
good
right.
idea. You can motivate the patient, incentives and compliance, what you're talking about.
Right.
If you reward the patient and reward what he's doing, then maybe he's more willing to do what you're saying to them.
Absolutely. Positive reinforcement is much better than negative reinforcement.
No, it isn't.
There are exceptions.
He does have a point. If somebody tells you you're going to die tomorrow, so are you going to stop now, or yeah, well, whatever, good job, So yeah, there's lethal force has incentives of its own.
Maybe you're right. It reminds me of a funny story. When I was in medical school, I had all these patients who had lung cancer, and as soon as they were diagnosed lung cancer, they would stop smoking. And my professor used to tell them, "It's too late to stop smoking. You should keep on enjoying it."
As a former smoker, I'd be like, woohoo, light up now.
What's the point? Kumar, did you have anything?
I was with her and we discussed.
Yeah, Brenda may want to add something. We didn't really, we
Came up with
pretty
it.
much just said that we didn't. If you wanted to say something actionable about our conversation, this would be the moment.
Do you want to summarize your discussion, Brenda?
Sure. So we jump in this year. So we talked a little bit about an accountable care model and what and how to make it successful, as well as talking about how to add more efficiency in the healthcare system. And some of the things that we kind of came to are to pilot an accountable care model in a testing ground that has certain key success environment already established and in place, some of which pertains to having an integrated, interoperable infrastructure system so that information can be shared more easily, as well as having access to data as a part of that structure. Donna had brought up some really interesting topics about adding more efficiency in the healthcare ecosystem and how to do that. And we had brainstormed ideas around taking a look at what doctors are spending their time on today, and are there any of those tasks that can be offset to a different kind of title or type of individual, so that the doctor can harness his focus on those areas by which he or she excels, and another individual can kind of jump in for some of those other areas, or a specialist can do so. So essentially, bringing those factors together.
So delegating non-important tasks to other staff, like nurse practitioner.
Just like non-practitioner type, I wouldn't say non-important, but non-practitioner required tasks to those that are not practitioners. And I think also, how do you bring technology forces together to to enable that?
Nice.
Yeah, you don't need a degree to change a bed, but it's really important.
That is cool. I think meaningful use already talks about having an EMR and the interconnectivity.
Right, and we spoke about the EMR and such as well.
All right. You're heading in the right direction. thank you. Rachel, would you like to talk about anything?
Covered it.
Okay, all right, so that's good. Patrick, so I guess that's it. Well, our next meeting is going to be a conference style, be an alternate between a conference and an unconference. And next meeting is going to be a panel discussion, and we chose a topic. That is social media in healthcare for next month.
Sweet.
What's that?
That's nice.
Yeah, yeah. Does anyone know any expert in that area? We want to try to bring them in.
They're best doctors.
As doctors?
One of the chief clinicians in Best Doctors runs a series of webinars and blog. You can just go to Best Doctors, look at their blog system, and you'll find somebody who publishes regularly. And they are they're regularly giving out advice to MDs in terms of how to navigate social media on there, and they're local here. So I would start with them.
Because I work in this building, and almost every startup talks about social media. And I feel healthcare is not taking advantage of that. There's not many startups around social media in healthcare.
Well, it really depends on your angle. I would challenge that tremendously.
What about T1D? The folks over at T1D?
What is that?
Type 1 diabetes. That's they've been running it's actually funded out of the Helmsley Trust Fund. They moved up from New York up to Boston area, and they've been running a focused patients like me. You know, except leveraging Facebook and leveraging apps. And actually, I noticed that somebody is speaking at there's an ex-Conway Life Science, or there's an MIT Life Science, Enterprise Forum Life Science coming up. So they're out and about speaking about what they're doing there. But they're local. They try to engage T1D patients, especially the youngsters, through people who grow up with these tools but have just found out they're diabetic, and it's a lifelong condition with type 1. So that's certainly another resource to look into.
Okay, thank you.
And there's a lot of advocacy groups that have lists and groups, and there's Society for Participatory Medicine.
Actually, and there's some big,
depends what you're looking for, but there's a ton.
And there are huge local players in the Society for Participatory Medicine in Boston area too. And actually, the Moby Health folks here are local too. So they.
What is that, Moby Health?
Yeah, Moby Health News, Brian Dolan.
Also, we'll be meeting up on the 5th floor on a room called the Havana Room as opposed to this room. So it'll be, a much bigger venue, so, people know to go there instead of here for next month.
So we're expecting close to 100 people next time, because it's a conference. People don't want to work hard. Here you have to work hard with your ideas.
Well, the two startups I know, you mentioned Patients Like Me, and Iora Health. They're another, but you could pig them if you put it the right way. You could get them to be like, ooh, we can present.
Exactly.
Don't tell them we're a startup trying to do healthcare stuff, because they might not want to do it.
I think isn't Iora in the building, or used to be?
I'm not sure.
Ooh.
They are.
Iora?
Iora Healthcare.
I don't know. I've seen their. I think I've seen their logo.
Another person to talk to is Lisa Galtieri, Gaultieri. She's a professor at the Tufts Med School, and she teaches health communications over there.
Okay.
So they've been doing a lot of thinking about engagement, social media, and she's started to become fairly active in the big Twitter user.
I know someone at Iora, but they're a programmer. But I could ask them, for a connection.
Absolutely.